regular screening and checkup in order to detect any form of cancer at the early stage. They made this known in Abeokuta during a sensitization and awareness program about cancer and treatment in Nigeria. They noted that cancer is no longer a death sentence once it is detected early and treated, and want Nigerians to always pay serious attention to their body and general well-being.
Quick medical care once that diagnosis, once they are suspecting of all this, when they feel that they are not sure and all that of anything, or they see any form of treatment that they're not sure of, or any form of disease, any form of ailment, particularly swelling. Commonly among the females, it is the breast or the cervix. For the men, it's either what we call aceton Yoruba or the prostate.
Early detection is the best. As a woman, even as the medical people have directed us, once after your period, you do your checkup by yourself, so you know if there's anything.
Prior to 2019, the last time I did a mammogram was in 2015. And when I look back, I realized that if I hadn't done that one in 2019, which detected it early, I would have been a casualty by now. Because certainly I wouldn't have done it in 2020 or 2021 because of COVID. And yet it was an aggressive form of breast cancer.
And staying on health matters, 2 grants that seek to facilitate access to essential commodities and routine healthcare services for COVID-19 have been reviewed. The grants will also strengthen the health systems in the country through targeted interventions for AIDS, tuberculosis, malaria, and other diseases. Health correspondent Kemi Balogun has more details.
The unexpected outbreak of the COVID-19 pandemic brought to light the need for strengthening healthcare facilities from the bottom up. Disruptions by the response to the pandemic caused a setback to many other interventions for diseases like malaria, HIV, and tuberculosis. This is why 2 projects were implemented to help address the shift in interventions and response to the diseases. The funding is under the ongoing Global Fund C19RM and RSSH grant as part of efforts to strengthen the healthcare system to respond adequately to future disease outbreaks.
Issues that brought about the devastation of COVID-19 are still here with us, which is our health systems, and we do still have the need to strengthen the systems for healthcare delivery. The devastation that COVID-19 was not just because of COVID-19, but because of the disruption to services on HIV, on tuberculosis, on malaria.
There's something unique about this particular project, and that is the way that the HIV, TB, and malaria communities are working together. As has been mentioned before, when you go down to the community level, those divides don't exist.
As the 2023 election draws closer, healthcare needs will still remain important. These experts are appealing for a smooth transition in order to improve the healthcare system.
COVID came, the resources are not somehow temporary, but they are meant to support our health system and for our people to also see the gap and to also keep reminding government, because we need to ensure that we have credible leaders who can be able to address our need.
What I expect from the government in 2023 is to create an enabling environment for health. And when I say create an enabling environment for health, is that the government needs to make deliberate steps to ensure that we retain our health personnel.
The grants are currently implemented across 18 states through a community system strengthening component. Kemi Balogun, TVC News, Abuja.
And away from health matters, youths in Maiduguri, the Borno State capital, have been urged not to allow themselves to be used as tools for destruction, but agents of peace and growth of the nation. This message was passed across by Christian and Muslim clergymen during an organized interactive session for youths aimed at fostering the bond of unity between them. TVC News' Jesse Tafida reports.
Nigeria is Africa's most populous country and has one of the largest youth populations. accounting for about 70% of the total population. Nations that utilize their youth population positively are considered more likely to develop. Nigerian youths have long been known for being drivers of change and social transformation. It is why Bishop of the Maiduguri Diocese has gathered young people from both faiths to sit and discuss how best to contribute their quota to the betterment of the nation.
The politicians have separated us. For us to achieve this, we need unity, love, peace, and mercy. This has really brought a lot of understanding among the youth in terms of them living together as Muslim and Christian youth.
The youth understand that regardless of their religion or ethnicity, they must remain focused and united to promote peace and national unity.
This is something that has been helping us, and we have been seeing positive results yielding out of this. From this kind of programs, we've met friends, we've met family members reuniting together. We've seen situations whereby unity is being fostered amongst wards in different communities, and a lot of activities is ongoing.
The youth pledge to use the knowledge acquired to bring about change in their various domains.
Supposedly, as a Muslim youth, I should be expecting challenges coordinating and organizing this program, but so far so good. This is the 4th year, and seriously, we have not faced any challenges.
What we've been taught here is to live in peace and harmony. Wherever we find ourselves, whether a Christian or a Muslim, we should always try to live as one.
Regardless of the current challenges facing the country, young Nigerians have a duty to remain committed to the cause of building a better and more progressive nation. Jesse Tafida, TVC News, Maiduguri.
And to this sad development, Nigerian comedian and on-air personality Oluwatobi Owomoyela, popularly known as Beteru, is dead.